Hi everyone, I'm Dr.RakheeYadav, consultant pediatrician. Welcome to my live session today. Today's topic is the effects of prolonged screen time on our eyes. And with me, my special guest today is Dr. Norazah, consultant ophthalmologist from Damansara Medical Center. Let me just add her in. Hi Dr. Azza, let me just add you in. So while I wait for her to join, Dr. Norazah has obtained her MBBS and her master's from University Malaya. Hi, Dr. Azza.
Hi,
Can you hear me?
Rakhee. How are you? You good?
Hang on now. Can you hear me?
Yes, I can hear you well.
Oh, I can't hear you. Wait, hang on.
Can you hear me?
Yes, I can hear you now.
Okay, that's
Sorry.
good. Wonderful.
That. No, I was trying to use obviously my earphones don't work. So So let me just reintroduce you again. So Dr. Norazah is she's graduated from her MBBS and her master's from University of Malaya. I won't say how many years ago. She looks very, very young, and the age does not do her justice. Her picture does not do her justice. So she did her fellowship in pediatric ophthalmology, and she's published articles in peer-reviewed journals. She's presented in a lot of conferences, local as well as internationally. And she's also a adjunct lecturer with MASA as well as the Malaysian Joint Health Community College. Yeah? Dr. Norazah, would you like to tell us a little bit about yourself?
Yes. No, some people ask me, what is pediatric ophthalmologist? Who is pediatric ophthalmologist, right? So basically, pediatric ophthalmologist is an ophthalmologist who take care of adult eye and all the adult issue, but they have special focus on pediatrics eyes. You know, some thought like, you know, pediatrics have eye problem. They do have cataract, they do have squint, they do have some form of refractive error that need to be corrected. You know, the aim is basically to prevent what we call blindness and poor vision.
Excellent. And I know a lot of children who actually need regular eye follow-ups with an ophthalmologist. And sometimes it's always good to have someone that's niche in that business, because you look out for a lot of other aspects that I wouldn't even have thought about. You know, I mean, my kids are under your follow-up as well. And, you know, it's just something simple as dry eye, which can actually lead to a lot of other issues as well. So which brings me to my first question, actually. What is happening to our eyes now that most of our children are having prolonged screen time? Like, I know my kids have got lessons from like 9 o'clock in the morning till 3 o'clock in the afternoon. We have webinars, online classes and all that. So what's actually happening to our eyes?
Now, this is very important topics. I think I'm glad that you brought this up, because it becomes, when we have the pandemic, the children are locked at home, and then they have to go to your online class learning, and they spend a lot of hours, not only for learning, then also for the entertainment. You see, they watch movies, videos online. So when somebody is exposed to prolonged use of digital devices, they get this condition called computer vision syndrome, or what do you call that, or digital eye strain. Okay, so well, we see that they're different. In adult, usually they will complain of eye pain, eye redness, burning sensation, but in children, they never complain. Most of the time, the mother will come to me and ask me, doctor, why do I look, my son have this excessive blinking, like they blink a lot, and then some even, you know, when they blink, they roll the eyeball up, and it looks very weird. And most of the parents, they manage to record that and they show it to me. So, well, the next question I ask them, how many hours you let your kids spend on internet, or sorry, on devices? So then they will say, well, before this, there's no limit to the screen time, but when he has this, then we started to, you know, control a little bit. So that is the things that I want to emphasize now. Kids never complained.
Yeah, absolutely. So what can we do to improve or prevent it from happening? Like, we know it's happening. There's so many things that are happening to them. So what can we do as parents, or even ourselves? Like, if we've got so many online webinars and all that, how can we prevent this from happening? the
Well,
digital eye strain?
I will share with you the tips. We call it the healthy eye habits tips later, towards the end of the program, so that all the views will be there
So
and
stay
already
tuned.
stay tuned, listen. But the most important thing is about screen time. So most of the time now we use gadget as a babysitter, because kids get absorbed into gadgets. They got very, distracted by it, and they behave nicely when they have gadgets in their hand. So my advice, general advice is, we do tell parents that those children less than 2 years old, no devices. We need to actually give them what do you call that, a physical stimulus rather than virtual. They need to know what is the difference between virtual and real, because they're learning, you see. And then for children from 2 years old to 5, we try to limit their screen time to 2 hours a day. It's just 2 hours a day. And doctor is very cruel to let my daughter to be just 2 hours, just 2 hours. Doctor, yes, just 2 hours a day. The rest of it, you have to actually give them a proper physical toys, and a lot of activities they can engage with, And for children bigger than 6, limit them to just education purpose only. So meaning that it's not that they can't actually watch movie and all that. My advice is, we want to if they want to watch movie, they want to watch videos, they can watch it from TV, not from devices that near to their face. Basically, what we want to prevent here is, one thing is computer vision syndrome, which involve dry eyes and accommodation problems and headaches around the eyes and all the symptoms. The other thing, we want to prevent the onset of short-sightedness. Have you heard about myopia? And we have school myopia, and now we even have what we call pandemic myopia, because the children are doing the near work, and we know there is strong association from doing near work for hours to progression and onset of myopia. If you have both parents, or if you are already a myope, then your kids already have a risk. One parent's myope, you have 3 times risk of getting your kids to have myopia. If both of them are myope, the risk goes high to 5 to 6 times more. So we can discuss about ways to prevent that.
Yeah, no wonder I see a lot of parents who come in who are wearing visual aids, spectacles and all that. Most of the kids are already on spectacles, so it's interesting that you mentioned this, that there's so many things that we can actually do. And what you mentioned, below 2 years old, no screen time, that is actually also backed up by what the American Academy of Pediatrics also says.
Yes.
Previously they said 1, but then now they're saying no, just below 2 years old, no screen time. Give them blocks, give them toys, give them, I don't know, dinosaur toys, main lompat-lompat, those kind of things, batu seremban lah, whatever that you want to call it, but get them physical toys rather than visual toys. And like you said, you want to reduce the gadget usage, so it's more of the handphones, iPads, tablets. Those are the ones that we want to reduce usage on. All right, so what about now, everybody's talking about COVID-19. What about COVID-19 and eye manifestations? Like, what are the sort of eye manifestations do you see in COVID-19 patients?
Well, in COVID-19, usually those who have COVID infection, they can have some sort of very mild conjunctivitis, like a viral conjunctivitis. The eye can be red, it can be infected, it can be swelling, it can be blurry vision. But I read about few journals reporting about endophthalmitis, meaning that the whole eyeball is actually affected in the severe cases of COVID. So basically, but one thing you must remember is that eye is also an entry of COVID virus to our body, you see, apart from our mouth and the nose. So that's why we advise people to wear a face shield, because it's one of the entry points. It's very big. I mean, we have to be careful about this.
Just to also note that children also can have like very red eyes, and sometimes very bloodshot eyes is also a sign of COVID-19, in the sense that it can also be a sign of MISC, the multi-system inflammatory syndrome in children, which usually happens a few weeks after COVID-19 infection. So eye can be a sign of COVID-19 as well. It doesn't mean if you mata merah aja, nothing. It's just normal eye infection, right? Yeah.
Yes.
So what about someone who's gone through eye surgeries, cataracts, those who've gone for their LASIKs? Can these patients get their COVID-19 vaccine?
Yes, of course. There's no contraindication for that. No, we must get the COVID-19 is the what do you call the main priority now, to vaccinate more people as much as we can.
Okay, so as soon as you're well, as soon as you're recovered from your surgery, I don't think there's any time limit, like you have to wait a month or 2 months or things like that. As soon as you can carry on with your vaccines. Excellent. So what about?
If
Sorry?
you see, when you go for an eye procedure like cataract surgery or LASIK surgery, even the recovery period is very fast. You know, even LASIK, the next day you can get good vision and you don't see anything different in your eyes. Cataract surgery depends on what kind of surgery and, you know, whether it is a complicated or non-complicated. Straightforward one, usually within 3 days you get back your vision. So I don't see is there any need to delay your vaccination, you know. Even you can get vaccination on the same day of surgery if you want to, if you need to, but usually we just, you know, get a few days so that you don't rush into that.
Rest. Yeah. I did LASIK before, and I was on call 2 days after that, you know, so you just have to rest it out the first day, second day, and you know, carry on with your work. I think the recovery time, like you said, is very fast. So as long as you feel well enough, just go ahead and get your vaccine. There's no need to delay. What about contraindications? Any of your eye patients that these are contraindications, you can't get the vaccine. Are any such patients in your eye clinic in that way?
Are you there? Sorry about that. Okay, so far I have not encountered any contraindication of COVID-19 vaccination for any of the eye disease, you know. So of course, this vaccination is still new, and we are looking into any reported cases of any inflammatory condition, some you know, some condition like optic neuritis and all that. We might need to look into that because it's autoimmune, but we do not know. But so far I have not you know, read any report about contraindication. Yeah, generally it's quite fine.
And what about side effects, like post-vaccine side effects? Do you get any eye manifestations? Like we usually say fever and things like that. You know why I'm asking, right?
Yeah, I know why you're asking, because you have that, what do you call that? Subconjunctival hemorrhage. Yeah. It is reported for them to have subconjunctival hemorrhage, but most of the time it's actually, what do you call that? It is not vision threatening and it's not life threatening. So if you worry, you have some, you know, some manifestation or any abnormality in your eyes, just get an eye check.
Awesome. All right. Okay, excellent. So back to the general tips. You've got those fantastic tips for us on how to maintain good eyesight, what we can do to maintain good eye health. So Azza, the floor is yours.
Okay, thank you so much. Coming back to your what do you call your statement, you said, you see, both parents wearing glasses and children start wearing glasses. It's actually the other way around. You see, nowadays parents, they don't wear glasses because they've gone through some refractive surgery. You know, there are many refractive surgery we can done to correct vision, but the kids wear glasses. I would say that maybe 10 years ago, parents do not want their children to wear glasses because they thought, like, you know, it's pity they're too young to wear glasses. That is actually a wrong concept, because the concept now is basically to get them to have good vision. If they have any underlying refractive error, it needs to be corrected for that the eye receive the image clearly and it goes to the brain and the child need all the stimulation to learn and to study and all. Why I say this? Because we want to prevent lazy eye. We know that if the brain receives blur image for many years, that's how the brain learned. And then after you reach certain years, the brain will never learn. That's why we need to correct all that before 8 years old. After 8 years old, we notice that if we correct, it will not help them with their vision. So it's very important. What we do now, we do screening at 4 years old. You know, maybe many years ago. Remember now, because of pandemic, we see a lot of patients that you know, they go to the school and they get their vision checked. And then we start to get referrals, you know, this child has poor vision, failed the vision test at school, and they have some form of refractive error. So you see the time, what you call time frame, is very short. We only have 1 year to correct that, 7 to 8. After 8, there are conditions which is reversible, become irreversible because of the brain plasticity. So nowadays we are going into a younger age. Now we are doing what you call that, screening at 4 years old. So it's better. 4 years old, nowadays kids are smart, they know ABC, they know numbers, we can check their visions, and then we can do the screening. You can take them to any shop for screening. If they find, I mean, optical shop, optician or optometrist, if they find something amiss, then they will get the referral to ophthalmologist. So as early as the earlier the better. All right, coming back to our healthy eye tips, I think what is easy to remember as ABC. So ABC is basically when we talk about A is to avoid, okay? Avoid excessive screen time. As I mentioned earlier, Rakhee, children less than 2 years old, no screen time. Kids 2 to 5, just limit them to 2 hours a day. And kids older than that, use the near gadget mainly for education. If they want to watch anything, movies, watch it from smart TV. Now, B stands for blink regularly. Now, why I say this, our eyes normally will blink about 14 to 25 times a minute. But when we are too focused, our blink rate reduces. Some even less than half, some even less than 7 blink a minute. But now, you can play this game, When you watch your kids using the phone, quietly you try to count how many in 1 minute how many times it blinks. Sometimes they don't blink at all. It's so scary, but it can last staring at the screen, So that's why we always, usually it's for bigger children who understand about blink and all that. So that's why we always remind them to blink regularly. And then this is basically to avoid dry eyes, okay? And always practice this 20-20-20 rules. Every 20 minutes, they get to rest for 20 seconds and look at the distance about 20 feet away, okay? Or if they pass the 20 minutes, for every 1 hour, tell them to rest for 10 minutes, every 1 hour. Okay, I think during the online class, the teachers are aware of this. They give the child break. The problem is that when the child is, take a break from their online class, they move to other gadget. They play another online games and all that, or they watch movies. They don't actually rest the eye. They don't go out and look at the distance. We need that, to relax the accommodation. Because, prolonged accommodation can lead to progressive myopia. It's a known risk, okay? Number 3, C stand for, I use a Malay word here called silau. So when we are doing the online classes and using the gadget, we must aware that there's no other disturbances from light, from outside, or reflections on the screen surface, so that they don't have the glare, because glare causes them to strain their eyes and even make the symptom worse, okay? D is about distance. So distance is very important. You remember 1, 2, and 10. 1 is the distance between the gadgets and the eyes. It's very simple. You just ask them to do this, take this, and then, this must be the distance. I hope you can see this, just like that.
So 1 foot, it's like sort of 1 foot now.
Yes, it's around that, And then at least you must tell them. Now, children, whenever you remind them, yes, they will hold the gadgets a bit far, but later they go near to their face, That's, you must constantly remind them. 1 feet away or 1 arm length, okay? 2 is basically for the laptop, 2 feet. 2 feet is very simple. How do you know 2 feet? You just high five to the screen. If you high five to the screen and the screen is basically around that, that's fine. And 10 feet is basically the distance between you and your smart TV or your TV. So just remember 1 to 10. Distance is very important because we do not want them to do more near work, to strain the eye, accommodate too much, because all that can lead to progressive myopia. Now, E is about ergonomy. What is ergonomy? So ergonomy is actually a science that studies a relation between your body and your environment of work. So you notice that nowadays when small kids, they have, even kindergarten, children, they have to go for online classes, they will sit on the dining table, correct? And then one will have one gadget, and the brother will have one, and all of them are forced to sit at the dining table, and the mother is there, like monitoring everything. But remember about their posture, right? The kids are small. The legs are hanging on the floor, and then the screen is wide, and it's like placed a bit up, and then the eyes are open wide, and they look at the screen. So this is a bad posturing for the child. We want them to know. So it's good if you can Google about Rahman position and what are the normal healthy posture that we must adapt. And that's so the children have a good posturing. So they are growing. You see, we want them to have a good posture. Now, lastly, F is about family time. When we talk about family time, you must have a time where everybody has no gadgets in their hand. For example, 1 hour before sleep time. You know, most of the time kids are on gadget all the time and they fall asleep
Yeah.
with it. Okay, why it is important? Because I want to emphasize on the effect of blue light. Have you heard about blue light, Rakhee?
Yes, I was actually going to ask you about those glasses. You know, would that be helpful for some children?
Okay, so before we talk about blue light glasses, we talk about what is blue light. Okay, naturally, blue light
Yes.
is there. Naturally, it's from the sunlight. So when the sunlight, you know, when we expose to sunlight, it will give us like you know, like a stimulus that hey, it's waking hours, it's waking time now. Your body, all your hormones are up, and then you start to work. But what happens to the evening, or you know, places where winter is earlier, it's become dark, and everything become dark, and your body become, you know, slowly tired, and you feel like you want to rest, right? So at least that follow this normal circadian rhythm. But what if you have a continuous proliferations of blue light, as if your body telling you it's daytime, daytime, wake up, wake up? So it affect their hormone, you know, it affect their
Oh,
melatonin hormone, their sleep hormone, and it really affect their sleep pattern. So I always tell my patient, you know, 1 hour before sleep time, especially teenagers, you know, please avoid from using this blue light, you know. So whether blue light filter is good or not, so well, I have for me, I feel the most important is not the filter, is how you filter your children from exposure from blue light. You have to educate them. You
okay.
have to tell them the effect. Now, there are many blue light filter cells in the market. Sometimes they are over marketing it. If you have the money, you want
Yeah.
to buy one, go ahead, not an issue. But if you don't, it's actually not an issue.
Okay.
Okay.
Wow.
Mm.
So we've got A, B, C, D, E, F. I'm just going to try to remember so that I also
Okay.
remember. So A is avoiding screen time.
Good.
B is B was B apa tu?
Look at my eyes.
Oh, blinking. Yes. So B is blinking. C is silau,
Yeah.
right? So you wanna, and then D is distance. The 1, 2, and 10.
Good.
1 feet between you and the gadget, 2
Okay.
between you and the laptop, 10 between you and the TV. And E is ergonomic. So get an ergonomic chair. And you
Yeah.
mentioned a Harman posture. And then
Mm-hmm.
F is family time.
Mm.
Amazing. The blinking thing, I'm definitely going to try on my kids. So, wow, that's a very easy mnemonic to remember how to maintain your good eye
Yeah.
health care. So, for
And
everybody who just joined me, you can always just relook the IGTV after this and make sure you look at this part where she explains ABCDEF of
mhm.
good eye health care. And
But
you were going
one
to say
last thing
something,
I
sorry?
want to
Yeah.
emphasize here is about outdoor activities. You know, how outdoors
Okay.
activities actually helps to counterback your near work effect in the development of myopia. There's study done,
Okay.
many study done. I mean, Sydney myopia study has one of the very famous effect of outdoors, and then they find that if you spend about 10 to 14 hours outdoors in a week, will actually counter your 1.5 or 3 hours of near work. You see. So it helps to slow down the onset of myopia and also prevent progressions of myopia. So if you're talking about 10 to 15, it's about 1 to 1.5 hours a day. So that's in
Wow.
average, Rakhee. That's the minimum time. So, you know, encourage them to go out. It doesn't mean that you have to go to the park. No, you have to be in this, during this pandemic, of course, we are locked down, we stay indoors, but, you know, you can be
Yeah.
indoors, but outside. You know, there are many activities you can do in the evening. Encourage them to go out. It helps them in, you know, having this eye strain and also controlling their onset or progressions of their short-sightedness.
Excellent. We have a question by Jelly Jamie. Hi, was wondering, does the phone blue light filter help with new phones? So you just go back once the Instagram IGTV is over, you go back. She's explained everything. Dr. Azza has explained everything. If you can afford it, basically the gist is if you can afford it, go ahead and get it, but there's no necessity to get one. It's more about how do you prevent your kids from being exposed to the blue light in general, right?
Yes.
Wow. So I managed to get the summary of that.
Oh, good.
So basically, excellent. I'm learning a lot. I'm definitely learning a lot. So basically, just to recap what you've just mentioned in the past half an hour or so. Sorry, ada kapal terbang kat sini. I live in Subang, you know, so
Okay.
always planes flying by. Give me a minute.
I can hear you well, actually. I don't hear any, it's fine.
Okay, so I apologize for that, but it's good to see planes taking off nowadays. There used to be one every 5 minutes, but then now it's like 3 a day or something like that. So I'm so sorry about that. But let me
No
recap
problem.
what Dr. Azhar has just basically said. So there is such a thing as digital eye strain or computer eye strain when you have prolonged exposure to screen time. So that's something to be aware of for parents. There is a certain exposure for screen time according to the age of the child. 0 to 2 years old is no screen time. 2 to 5 is 2 hours per day, and above 5, meaning 6 and above, the schooling age is for education purposes only. Try to limit the amount of times they are gaming online because you're already exposing them to online classes. So before this, all pergi sekolah, go to school physical, there's no online, and they come back and do a bit of online gaming. I think it's fine, an hour or two. But then now you've got online classes from 8 to 4, and then they've got online gaming after that. So try to limit as much as you can. And then with regards to COVID-19, you can get some manifestations of the infection, as well as there are very, very minor and very rare side effects post-vaccine, which you can always just scroll back on the IGTV and listen to that again. But basically, there's no contraindication for any eye issues to get the COVID vaccine.
True.
And the ABCDEF of healthy eye care, which I just recapped just now. So that was basically the gist of what Dr. Azhar has been telling us. A lot more in length. So if you've missed any of it, do go back and just listen to her again. Are there any last advice that you'd like to give to your followers, your fans, or your future patients?
Well, funny thing, when the patient, when the parents comes to me, when the children have eye blink, issues with dry eyes and blinking and all related to digital device, and they will say that, when I tell them, and then at the end of it, I wrap up what was the treatment plan like is for now and for future and all that. And they will look at the children and say, see, doctor told you not to use your iPad anymore. So I said, no, I didn't say that, because why? Nowadays, you do not take the gadgets away from them. It's very dangerous because children will never complain then, because they want to protect that everything is fine. It's very important to educate the kids now, because now you know that we have to use gadget in our time. Rakhee, maybe 20 years ago, we hardly used Instagram, Facebook, and I have struggling on Instagram because of this. I have to learn from my son. Thanks to you. If not, I will never change. Okay. So you see, but now we have to make ourselves more savvy on this, But our children, there are many years to go. We do not know in future what is their, the challenge like with the devices. So it's very important for us to educate them about the future, effect of using all devices from their glasses, the future of blue light effect. Theoretically, we know that it can harm the retina and all that, but it's only in vivo, in the lab, and they then study in animal. But in human, we don't see it now because maybe devices been used for the last maybe 5 years, 6 years. But what if in future, 30 years from now, then we start to get to see and the effect of this, long-term effect. So my advice is always not to take the gadget away from the children. It's actually to increase their awareness about the health issue that can come with the use of devices unlimited, and know what are the ways to basically overcome these problems.
So basically empower your children with the knowledge of knowing how and when to use their gadgets or their online classes, online media, versus just taking it away and saying, no, it's no more, So let them learn how to live with it in a proper way, in a sustainable way, because this is the future. Tech savvy kids are something that, you've got to make sure your kids are tech savvy in some way. So removing the gadget, not the option, letting them live with it in harmony and in the right way so it doesn't harm their eye health.
Sure.
Right?
I hope the message is, everybody is listening.
Loud and clear.
Loud
yes.
and clear.
Thank you so much, Dr. Azhar. It was wonderful. Thank you so much for coming live with me. I think you've answered a lot of my questions, because I also was very personally worried about my children, myself as well, because of the number of online webinars and, a lot of classes that have switched online. Even telemedicine, now it's seeing my patients on a computer rather than seeing them physically. you know, so a lot has changed in the sense that we're using a lot of online and gadgets in that sense. So thank you
Yes.
so much for telling us all these new information, as well as educating us on good eye healthcare.
Yeah.
So with
Thank
that,
you for
I'd like to say
inviting me.
you're welcome, most welcome. So take care, Dr. Azza. I'll see
Okay,
you
take
soon.
care. Bye.
Bye.